Ashley.
Yes.
How are you? Other than that being good, how are you?
I'm right. Oh, let me change my name on here. I don't know why it always says that.
For those of you that they didn't make it on the quiz for today, can you determine the issue for me to best help you? If you did not study, say I did not study, and then deal. There is nothing that we can do. But if you did study, then you are studying ineffective, and you need to find an effective way. If you did not understand the lecture from last week, then it is also your fault, because during my lecturing, if you are unable to understand something, you have to stop me and you have to tell me, I did not understand. If you do not ask, I presume that you did understand, and I will keep going further. So, is there any concern in relation to my class presentation? Or do you have another concern that I can help you with? There's only one thing that I cannot help you with. If you did not study.
I have a question real quick. Can you go into the questions and see, like, do we all have the same questions on the same number, or is it kind of like random?
It's a random.
Okay. Because there was one question where it said something.
No. Do you have any concern about any question?
No. Just I feel like one of the questions didn't have the correct answer on there. It wasn't pointing to the right thing.
Do you remember that question? What was about? I can go and look for it.
I screenshotted it. Do you want me to send it to you through email?
Hold on a second. Stay with me.
Okay.
Just stay with me.
It was the one with the dental process of the maxilla.
Hold on one second. I can get you to what you're looking for. Okay. Now everyone is sharing the questions with me, correct? Can you see them?
Yes.
If you have any concern about this question, let me know. I'm going to pull every single question, and whenever I get to any question that you need to ask, you can stop me, okay?
Okay.
Any question in relation to that one?
No. There's one about the maxilla process where I showed like the teeth and you're supposed to identify.
I'm going to pull all the question, and if anybody got another question, we can talk about it. Just you need to stop me.
I think I'm seeing the same questions. Oh, there we go.
So in those questions, you are seeing same picture, but the question is asking different. Like, for example, this one is asking about cribriform play.
No.
Previous one is asking about Voomer. That's asking about dorsum silla. And that asking about optic canal. Clinoid process.
It was the one with the frontal process of the maxilla.
I'm gonna go over all of them until you guys see something, and you can stop me, and we can talk about it. So whenever we get to any question that you need help on, you can say. This one,
Which one?
can you see it?
The last one I see is 66. That's fine. I hate to take up time. It's probably just an issue that I had.
Uh,
No, I have the same problem too. I was thinking about that.
how about, do you see it?
Yes, that's the one, because I thought that
Okay, now this one is asking you about the zygomatic arch,
it wasn't that one.
correct?
No,
Yeah.
it's not.
It's not that one. It was
Not-
no.
But it's the same picture,
Yeah.
It's the same picture.
and they're asking about mandibular ramus.
No.
No.
It was the process of the maxilla. Yeah.
Uh,
Isn't that letter E?
Should be.
No.
there you go.
Yeah, that one.
Do you see the picture right now, right?
Yes.
They're asking about the maxillary process,
Mhm.
frontal process of the maxilla. That
Yeah.
means supposed to be letter E. And your test, what was it?
That clears it up for me.
Huh?
That cleared it up for me.
Let me see if they have it wrong.
On our diagram, it shows that it's like by the teeth, not so close to the nose. So that's why I guess I get it wrong. I thought I was off.
Yeah, it's correct on the test. It
Okay.
is supposed to be letter E, the answer. Any other question, guys?
Professor,
Mm-hmm.
on the review, it told you what you got, but it didn't tell you which ones you got wrong. Is that just part of the system, or?
It's not a part of the system. I don't understand why you guys, when you go review, you don't see the one you get it and the explanation underneath. Do you see that or no?
No, it just let me looked at the questions and everything was grayed out, showed me what answer I selected, but no explanation, and it didn't tell me. Like I recall in quizzes, it would mark the one that you got wrong in red, so that you knew which ones you got wrong. But during this
one
test,
right now, they cannot do so. It doesn't.
no, it doesn't tell me anything. I'm looking at the review now.
I
Yeah,
think you guys are supposed to.
It's-
James, look at one of the questions where it says mark 1 out of 1. If it says 1 out of 1, you got it right. If it doesn't,
Oh.
1 out of 1, you got it wrong. But it doesn't give us the answer.
Gotcha. Thank you. I
I
see that. I see that.
mean,
That's fine. That's all I need.
If you, I don't know if you want to refresh your page and go back one more time to double check. I give more options for you guys the way you need to look on the test. Probably you will have more information. Just refresh your page.
Dr.
Did
Baha,
I get that one wrong?
Yes, ma'am.
I had a question. I noticed that all the images that we were, looking on, they were all CT. So I just wanted to see.
You are not learning CT or MRI. You are learning what? What's your class that you are learning?
The anatomy.
Cross-section anatomy. So it doesn't matter if it's CT or MRI.
So
You
it's
need to
not,
know the
the
anatomy.
view is not going to vary much.
What do you mean?
Like looking at a CT versus is looking as an MRI.
Your anatomy will never change whether you are looking at it CT or MRI. Your occipital bone will remain toward posterior regardless. Yeah. Most of the picture in your anatomy book, the one we are using, are CT scan.
Okay.
Yeah.
Thank you.
Any more concern or question, guys?
Nope.
Is there a way to make the pictures on the quizzes bigger? I had a hard time reading the little tiny letters and where the lines were going.
If you push on your computer shift plus, you make it big as much as you want. Every time you push that function, you can make it bigger or you can make it smaller. This is
Okay.
something on your computer that you need to do.
Okay, thank you.
Mhm. Any more question? No? Okay. As I said, for those of you that they did not make it today, please try harder for the upcoming one. And most of the time, if the student failed 2 quizzes, will not make it toward the end. So on the upcoming one, try to make it or try to work a little hard. During the lecture, if you are not understanding, you need to stop me and you need to ask me. If you don't, I presume that you do understand.
Do we have 2 retakes at the end of the semester, just like the other class?
The retake will be after your final. If you do not make it to a 78 overall.
And we are allowed to have 2 retakes?
And if the retake will help you, because when you retake, the max that I can give you is 78%. So sometimes the retake doesn't benefit. It depends on how much your overall grade. If your overall grade is very low, the retake is now, it's not going to benefit you. Okay? So try not to have this in your mind that, oh, I can retake, because the retake will increase your overall grade by probably quarter or half. So if you are 76% overall, the retake is never going to help you. Believe me, it's never going to pull you 2 points. So do not rely on the retake.
I have a question. So like in my example, I did the exercises, but I didn't do the exam part. How much does that affect my grade? Is it only 10% of the all exercises and the exam part?
No, it will be fraction. Today, I will put the 0 for the people that they did not complete some of their assignment. And then you can look at your overall grade by the end of the day.
But what I'm saying is each, like say if I didn't take the exam, does that void my exercises?
I didn't get your question now.
On that week 1, we have the exercises. I didn't take the exam part because I thought that was our test. Because like in our previous class.
Yeah, you do not, yeah, I understand. You don't lose the whole entire 10% out of this. So you lose only fraction of what you missed, of course. If you did job, you still get paid for it. If you do 30 minutes, you get paid for 30 minutes, right? Yeah. Any more questions? No more question? Okay, you guys take a 5-minute break, and when we come back, we can start our new lecture. Enjoy it.
Is he starting? Are we on break again? Are we on break?
5 minutes, James.
Sorry about that. That's all right. I think we're on break.
Yeah, no, we are.
All right, everybody's back. Okay, ladies and gentlemen, as you guys remember, last week we said we are learning anatomy per region, not the way you have learned it previously with the Dr. Jacobus. And the first region we start talking about is cranial region or cephalic region. In the last week, we did cover the bone of the cranial region and the bone of the facial region. For today, we will continue further to learn what's inside the cranial region. So we're gonna move to the next chapter, which is related to the brain. And that chapter is divided in 2 sessions. We will cover part of it today, and next week we will cover the next part. For today, we will talk about the membranes that enclosing the brain, the ventricles of the brain, part of the brain structure, which is the hemisphere, right and left cerebral hemisphere, including the encephalon and limbic system. So if you look on the slide in front of you, hopefully everybody can see it. We're gonna talk about the brain meninges, ventricular system, cerebellum, and the diencephalon. Also, we're gonna include the brain emotion, which is, we call it the limbic system. On our next meeting, next week, we will cover the rest of the brain structure. So this chapter is divided in 2 parts. You guys get it? Okay, before we start, if you guys remember.
Sorry to interrupt you, but I just want to point out that the diencephalon is spelled incorrectly.
Okay, I have a lot of misspelling. Sorry, I will fix it after the class. All right. If you guys remember that last week when we talked, we said that your body consists of cavities, correct? And of course, let me take this out. And the cavities of the body are 2. Mr. James, what are the 2 cavities of your body? Please unmute your computer and answer. Mr. James, the cavity parts of your body are?
The ventral and the dorsal, I'm sorry, or
The ventral and the dorsal cavity.
cavities.
Mr.
Yeah.
Anthony, the dorsal cavity consists of what?
The head and the spinal cord.
The head and the spinal cord. Mr. Donald, what structure in the cranial cavity and what structure in the spinal cavity?
Can you repeat the question? I'm sorry.
What structure do we have in our cranial cavity and what structure do we have in the spinal cavity?
So spinal cavity
contain what structure?
Can I help him out, Professor?
Huh?
Can I help?
Go ahead, please. He will appreciate it.
The spinal cord.
Spinal cord.
And
And
then
the
the brain?
brain cavity?
and the brain.
The brain, correct. Now, every single cavity in your body, the cranial cavity, the spinal cavity, the thoracic cavity, the abdominal pelvic cavity, every single cavity in your body, it is lined by a membrane. You guys need to differentiate between word covering and lining. If I cover from outside, that will be covering. But if the cover is from inside, then we refer to it by what?
Lining.
Lining.
A quick
Correct.
question. With the covering, would that be considered fascia?
Fascia, possibly yes. So every single cavity in your body, cranial, spinal, thoracic, abdominal, pelvic, it is lined by a membrane. And this is the first thing that you will learn when we cover every single cavity, because today we are talking about the cranial cavity structure, which is the brain. Then first we need to discuss the lining membrane. Mrs. Leticia,
Yes.
what's the name of the membrane that lining your cranial cavity and your spinal cavity?
The meninges.
The meninges, correct. So you guys can see the board? Can you guys see my board?
Yes.
Okay. So this is your brain, and this is your spinal cord. And we say your brain and your spinal cord is covered by meninges. There are 3 meninges. The blue one, the one comes in contact with the brain. So this is the brain, and that's the spine. This blue membrane, I would call it pia, matter. If you move away from the pia, and you need to understand that the pia matter comes in contact with your brain and your spinal cord. Even your brain has jury and silky, if you guys remember, up and down. So that membrane, the pia, will move up and down too with it. If you move away from that membrane, the meninges pia, you will see another meninges layer, which is, we call it arachnoid. So this is arachnoid meninges layer. If you move away from the arachnoid meninges, also you are going to see another membrane and this is, we call it dura mater proper. If you move away from the dura mater proper, you will see another fold that belongs to it, and we refer to it the periostal. So this will be dura periostal. And finally, what comes in contact with the dura of the periostem is your cranial and spinal bone. So the vertebra and the cranial bone. That's cranial bone, and this is spinal bone. Or if you want to call it the vertebra, you can do so. To simplify it for you, this is the cranium. The cranium is lined with the layer that comes in contact with it from inside. Mr. Badella, Salvador, what do I call that layer that line and comes in contact with the bone?
The dura mater?
Which part? Because the dura mater, it's 2 of them.
The periosteum?
The periostal dura mater, correct. Underneath of it, which meninges layer you will see?
The arachnoid? No.
Dura mater proper.
The dura mater proper, correct. Underneath of the dura mater proper, Mr. Brandon, what do you see? Which which meninges?
Arachnoid.
Arachnoid. Underneath of the arachnoid, Mrs. Sarah, which meninges you will see?
It's the pia mater.
The pia mater. And remember, the pia mater is the one that comes in contact with your brain structure and spinal cord. So if you look at all the meninges layer that covering and enclosing your brain and lining your spinal cavity and the cranial cavity, those are in sequences from outside to the inside: periostal dura, dura proper, arachnoid, and then pia. Did you guys understand it?
Mm-hmm.
You have to know them in sequences.
And,
Now,
Can you give me the top one again? The very out one?
the blue one,
Yeah.
that's the bone.
No, the one, the dura mater, the one that's
Periostal. Periostal. Yeah. Do you know that your bone is lined and covered by a very thin layer? We call it periostem. If you ever remembered, learn it with Dr. Jacobus, we call it periostem.
Right?
It's very, very thin, very, very thin layer. Okay? Do you guys have any questions so far?
It's the image that's on 87, right? Page 87 of the meninges. I just want to make sure I'm looking at the right image.
What I did over here, you do not have it in your book.
Yeah, I was gonna ask you, is there any way that you can just like step to the side for a little bit so I can screenshot that image?
Is good?
Thank you very much. I appreciate it.
You're welcome.
The layers are listed on page 87, Ashley.
What time? I mean, what page?
87.
Okay, yeah.
Towards the bottom. Yeah.
All right, thank you.
Now, if you look at every single layer of the meninges, I didn't put it close to each other, correct?
Right.
The only two layers that comes in contact with other structure is the periostal that comes in contact with this is the cranial bone and this is the periostal dura. So, and the other one is the pia, which comes in contact with what? With the brain and the spinal cord. All other layers basically are a little bit apart, which is they create spaces. You guys get the point? So the space between the dura periostal and the dura proper. Do you see that space?
Mm-hmm.
I do. Hey, doctor, I have a question.
Go ahead.
You're referring to it as the periostal, but in the book, and the way I've learned it in the past, is periosteum, which I spelled it there in the chat. Are both acceptable terms, or do you see the way I spelled it? P-E-R-I.
I can. It's too hard for me to understand. I'm sorry. Can you repeat?
See the way that I spelled periosteum in the chat there? See the chat?
Yeah, I know the periostem.
Oh, okay. You're just referring to it differently. Is there a reason? You're
What do you
saying
mean?
periostal. Why is that?
Periostem or periostal is the same. You can use either word. Yeah.
Okay, thank you.
You can use either one. Periostem
thank you.
or periostal. It's the same.
Okay, thank you.
Professor, in regards to that, does that depend on the context?
I can't hear you.
How you use it? In regards to that, does it depend on the context on how you use it?
Use what?
Periosteum or periosteal?
It just a matter the way you want to spell it. It depends on how you put it in the sentence.
Yeah, so that's the context, right? Okay.
Yeah. Oh, yeah. Yeah, you can say that if you want.
Okay.
Okay, so we said there is a spaces between the dura meninges. The space between the dura periostal and the dura proper, we call it epidural. So this will be epidural space. And your epidural space contain fat. If you guys look at this picture, everything I am saying it belongs to your cranium with the brain and to the spinal cord. So whatever applied to the spinal cord is also applied to what? To the cranium, because those are in connection. Okay?
Dr. Ba, can you move the screen closer to the board?
Is it that way?
No, it's still hard for me to see.
If you could just move the camera up a little bit.
Have a full. Can you see everything now? Yeah?
Yes, thank you.
Okay. So, between the dura periostal and the dura proper, there is a space, we call it epidural, and that space is containing fat. Ladies are pretty much familiar with that space. If you are mommy and you've been in a labor at least one time, if it happened, the doctor, he give you a shot to numb the bottom part of your body during the labor, so you don't feel that much pain. We call it epidural. So this is where the doctor will give the shot, the anesthesiologist, to numb you during your labor. And we call it epidural space. Now, if you move, what space between the dura mater proper and the arachnoid? That will be subdural. So this space is what? So that it is epidural, that means this is, we call it subdural space. And the subdural space in your body around the cranium and the spinal cord contain venous sinuses. And the venous sinuses are responsible for returning the blood from your brain and the spine back to the heart. And we'll talk about the venous sinuses and blood venous drainage in the next meeting, not today. But will be wise to remember what does that space contain. If you move further, the space between the arachnoid meninges and the pia, so between the blue and the red.
I
That
just have a
space,
question, I'm sorry.
Uh-huh.
The subdural is on top of the arachnoid space, right?
I can't, yeah.
Yeah, okay.
So the space between the arachnoid and the pia, this is, we call it subarachnoid. And the subarachnoid space contain cerebrospinal fluid. And we'll talk about the cerebrospinal fluid in a little bit. You guys understand what I said so far? Do you have any question, Mrs. Ashley?
No.
No question. Okay. Meninges are considered brain protection. So if I ask you, what does protect your brain and the spinal cord? Number one structure protecting your brain and spinal cord are the bones. But also the meninges serve as protection. Okay? If you look at this picture, basically, this picture is they cut coronal. Can everybody see me, right? This is the cut. They took that part and you are looking toward inside. If you want to understand the picture, you need to know the orientation. So the top part of the picture is what? Anatomic orientation. What is the top part of the picture, Mrs. Ali?
Anterior.
Superior.
Superior. And this, the bottom?
Inferior.
And then you are looking at it, mirror image, right and left respectively. Right and left. So if I'm coming from superior toward inferior, from the top toward the bottom, in sequences, I will see underneath of the bone immediately the dura periosteum, and underneath of it, the subdural. If you go further down, you will see the dura proper, and underneath of it is the subdural space. What did I say earlier? The subdural space contain
Venous sinus.
Venous, blood, sinus. So can you tell what they put for you in blue? That's the venous sinus. And of course, do you guys know what word sinuses mean? The way you learned last week, sinus of the facial bone, it's a wide cavity. But those sinuses, they contain what? What does it contain? The sinuses of your bone?
Air.
Air. So this is why we just call them sinus. But over here, this sinus contain blood. And this is why I call it venous sinus. Do you see what I'm pointing on? Okay? Now, if you move further toward more inferior, toward more down, you are going to see another space, another layer, which is the arachnoid matter. If you move underneath of the arachnoid matter, you are going to see a space, which is that one. And we call that space subarachnoid. Subarachnoid. And I said that space contains cerebrospinal fluid. So all what you see over here is a part of the cerebrospinal fluid. They put it in blue. If you move further more, you will see the meninges layer that comes in contact with the brain. And this is the pia. So whatever you have in yellow represent the pia matter. If you did not understand, say, I did not understand. That's mean everybody did understand. You have learned previously with Dr. Jacobus that your brain consists of two cerebral hemispheres, right and left. Does anybody remember what does connect those hemispheres?
Corpus callosum.
Corpus callosum. So you need to understand that this is the right and this is the left hemisphere. They are not like this in your body. You need to understand that those two hemispheres are completely isolated and they are only connected by one single area. Do you see the tip of my finger? This is the only area that connect the right and the left hemisphere. And we call this area we are connected by corpus callosum. You need to understand that there are certain functions in your left hemisphere that it is not on the right same. So each hemisphere has a function that the other one does not have it. Did you get the point? No? Good.
Yes.
Okay, so based on this, when the dura mater or when the meninges fold to cover your brain, they don't go that way. No, look how they do. They go cover this way and they go between the hemisphere and they'll go up and fold this way. Did you guys get it? So the meninges, the dura, does not cover this way, both right and left cerebral hemisphere. No, they go between and they create folds. Did you understand the fold? Each of those folds given a name. If I go back to this picture, look at the right and the left hemisphere. Can you see what I'm pointing on, guys?
Yes.
Okay. Do you see how the meninges, they move with the fold? This way and that way. So they create fold. Those, the dura meninges fold, they give them a name. The name of the fold between the right and the left cerebral hemisphere, we refer to it by falx cerebri. Everyone point on the falx cerebri. And if you wish, you can write down next to it the fold of the dura mater between the right and the left hemisphere.
It's the fault of the what? Sorry.
The fold of the dura mater between the right and the left cerebral hemispheres.
Professor?
Yes, sir.
I don't really get the perspective on the falx cerebri. I can't really picture how it
What's your
actually
name,
looks.
sir?
Michael?
Mr. Michael. Those are your two cerebral hemisphere, correct? Right and left, my hand.
Yeah.
We said they are not completely connected. They are only connected by what? By the tip of my finger.
Yeah.
The corpus callosum. Do you see that crack between my two hands?
Yeah.
Meaning your meninges, when it comes, does not go over the crack. No, it goes fold inside like this and then move up. Can I erase this picture?
Yes.
This is your corpus callosum. This is the right and this is the left hemisphere. Your dura meninges, when it covers, does not cover this way. No, does not cover it that way. How does it cover? It goes this way, that way, that way, and that way. What do I call this fold of the dura between those two hemispheres? Falx cerebri. Did you understand, Mr. Michael?
Yeah, I got it. Thank you so much.
All right. So basically, in this picture, they are showing you the falx cerebri. This is what I'm going to put in yellow. That's your falx cerebri. There. Also, you have learned that you have something we call small brain. correct?
Wrong.
What's the name of your small brain?
Is that the cerebellum?
The cerebellum. The cerebellum is the small brain, correct? Why they call it small brain? Because anatomic structure resemble the cerebral hemisphere, the big brain, but it is what? Smaller. Now, your dura, when a fold, will fold between the cerebrum and cerebellum. So in this picture, the way how I draw it, this is your cerebellum. And the dura is going to fold where? Between cerebrum and cerebellum. What do I call that fold of the dura between cerebrum and cerebellum?
Falx cerebri.
Tentorium cerebelli. Did you see what I highlight? Circle. So if you wish, you can write down next to the tentorium, fold of the dura mater between cerebrum and cerebellum. And if you want, I can point on it. This is your tentorium.
Professor, I just want to say thank you for color coding it. It's very useful, especially for visual person like me. Thanks.
As long as I can help you. If there's anything I can help you better, you need to share. Okay? I like to share ideas, guys. Sometimes I'm not 100% perfect. And you guys know, nobody's completely perfect. So if any one of you has something valuable can share with us, please, you could share.
Hi, Doctor. I shared a different picture with yourself. I emailed it to you right now. Shared it with the class on WhatsApp.
If you want, can you put it on the chat? You can add it. Can you copy it on the chat? If it's picture,
I'll try. Yeah.
Anyway, we'll see it later on. One more thing. Look at that dura. Also, the dura will fold between the right and the left cerebellar hemisphere, which is like this. And then we'll create another fold. We call it falx cerebelli. Falx cerebelli. So, bottom line, how many fold is the dura mater provide us? The answer, 3 folds. Number 1, between right and left cerebral hemisphere, and I will call this falx cerebri. Number 2, which is this one, between cerebrum and cerebellum, right and left respectively. And we call it tentorium. And this is number 3, between the right and the left cerebellar hemisphere. And we call it falx cerebelli. Do you have any question? No?
Can you repeat the last one again? You said the fold left and right, what is what?
What is this structure, the one those? Do you know what is those?
Is it the Sierra something?
Not something.
I didn't hear it.
That's your small brain. We call it cerebellum.
Okay.
Cerebellum. So this is cerebrum. This is cerebellum.
Quick question, Professor. I'm sorry, James. So for the cerebrium, there's two hemispheres. With the cerebellum, are there two hemispheres as well, or two lobes? Or?
Cerebrum are two hemispheres, and the cerebellum also they are two hemispheres. Yes.
Are there different names for those, for the cerebellum?
No.
Okay.
Professor, what was structure 2? Was it the tentorium?
The tentorium is the
number 2.
Cerebrum and cerebellum.
Okay, but what was the second fold? What was that called? Yep. Cerebri. Got it. Falx cerebri. But I don't know what 2 is. Yeah, the tentorium. Thank you.
There. If I ask you, what does separate the right and the left cerebral hemisphere? Your answer will be?
The falx
cerebri.
The falx cerebri. The falx cerebri. What does separate cerebrum and cerebellum?
Tentorium.
What does separate the cerebellar hemisphere?
Falx cerebri.
Can you repeat the falx cerebri again?
Falx cerebri, falx cerebelli, and tentorium. Correct? So if you look over here, they're showing you the right and the left cerebral hemisphere and are separated by the falx cerebri. Any question? No question? Okay. Now, let's go and look at some images. Everybody can see this picture. This is an axial transverse cut at the level of the brain. That's mean the top is anterior, the bottom is posterior, right and left respectively. You'll be able to tell the right and the left hemisphere. And we said earlier that they are separated by
Falx cerebral.
exactly there. So that will be your falx cerebri. Now, if you look at the cut map, they didn't make it 100% that way. What they did, they put it what? Oblique. Make sense? So this is the posterior and that's the anterior. That's mean this is the posterior part, which is mean that one. So you are seeing the reflection of the tentorium. So this is one hemisphere and this is the other one, cerebral hemisphere, right and left respectively. And those are what? The cerebellar hemisphere, right and left also. What there?
Professor, I have a question, but it's not really related to what we're learning right now. These CT images and MR images, are these like the set standard? Are these like the best they're going to be?
What do you mean? I didn't get your question.
So as an MRI technologist, is this something that we should be expecting to produce?
I mean, you will see same anatomic structure whether you are doing MRI or CT scan. It's just a matter that you will see it differently. But the same structure, the answer is yes. In most of the images that I have for you in the handout or on the slide over here, it is MRI. Despite the fact, if you look at your book, they have, for the same structure and the same cut level, they have one MRI, one CT scan, one MRI, one CT scan. But
yeah,
there is no.
My question is about the windowing.
No, well, the CT scan doesn't use windows like the MRI, but they use the same cut plan. The answer is yes.
Okay, thank you.
All right. This is a coronal cut, and this coronal cut, which is like this. So the top is superior and the bottom is inferior, and right and left. So what you are seeing over here, this is the right cerebral hemisphere. This is the left cerebral hemisphere. This is the right cerebellar hemisphere, and this is the left cerebellar hemisphere. And of course, what does separate the right and the left cerebral hemisphere?
Falx cerebri.
Falx cerebri. What does separate the cerebellum and the cerebrum? The answer will be
tentorium.
Tentorium, correct. You guys get the point?
Yes.
This is midline, exactly, midline sagittal. As I said earlier, which is something we're going to talk about it later on too, the right and the left cerebral hemisphere are completely isolated except by one single area, which is this area. And that area, we call it the corpus callosum. So the yellow, where I highlighted, this is the corpus callosum, where the right and the left are connected. If you look at the very superior part of this picture, you are seeing the reflection of the dura mater. If you look, this is the cerebellum. So this is cerebrum and this is the cerebellum. And of course, we said earlier, what does separate them? That fold, which is we refer to it by the tentorium. The tentorium. Also, in this picture, you are seeing just a portion of the falx cerebelli, which is this part. So the falx cerebelli basically is separating the right and the left hemisphere. So if I go to the previous picture, basically, this is your falx cerebelli that separate the right and the left cerebellar hemisphere. Did you guys understand?
Yep.
Any question? So one more time, this is the, all this is the reflection from the dura. Dura meninges are very thin layers. You do not see them that very good, okay? And if ever, the only one you'll be able to see is the dura mater as outer layer reflection underneath of the bone and some of the fat that, as you see it over here. Question? No question. What do we have inside of our cerebrum, right and left? A protection. Exactly. So you have pouches filled with the fluid, and we refer to those pouches as ventricles. So do not mistake the heart ventricles, okay? Also, we call them brain ventricles. And of course, Those brain ventricles are filled with the cerebrospinal fluid, and their function is cushion. Okay? Protect and cushion. And of course, those ventricles, when we get older, we have them in different. Also, specific diseases, they look different. Like, for example, those are 2 huge ventricles. That's mean this patient, he has probably a very bad dementia, memory stuff problems. Okay? Let's learn about the ventricles. What are the ventricles of the brain? To understand it better, I want you to look at my finger. Can you see them?
Yes.
Yes.
Okay. Now, I'm going to show you only one finger in this way. This is the way how the ventricle in each of my cerebral hemisphere, right and left. Okay? So, we call whole entire lateral ventricle. So you have 2 lateral ventricles, right and left. Each of those lateral ventricles consists of major part, which is this one. We call it the atrium. And the atrium is the widest part. So this is the atrium. And then you have extension out of this atrium to your frontal bone or frontal lobe of your brain. We call it frontal horn or frontal extension. And then you have one extend toward the temporal. We call it temporal extension. And then you have one toward the back. And we call it occipital extension. Do you guys understand it? So, where is the lateral ventricle located?
On the sides.
Huh? The 2 lateral ventricles are located where?
Right.
You need to know where is the location because this is where you're gonna point on, correct?
Right.
Left and right cerebral hemisphere. Each of those consists of what? Consists of atrium. So this is the atrium. How do you see this picture? You are looking at my ventricle this way, from the side, correct? So if you wish, you can put, for the top of your image is superior, for the bottom is inferior, this is anterior, and that's the posterior. So one more time, superior, inferior, anterior, posterior. We said each lateral ventricle located in cerebral hemisphere and consists of an atrium, and then has 3 extensions. Toward anterior, where is the frontal lobe of your brain, we call it frontal horn of the lateral ventricle. Toward posterior, where is the occipital lobe of your brain, and I'm talking about this part, we call it occipital horn. And toward inferior, where is the temporal lobe of your brain located, we call it
lateral ventricle.
Which part of the lateral ventricle? Temporal horn.
Temporal horn.
Exactly. So all those colors, the one that I put for you, are lateral ventricles. Where they're located? Right and left, cerebral hemisphere, and consist of the widest part, which is this one, the atrium, and then 3 extensions, frontal, occipital, and temporal. Your right and the left lateral ventricle are completely isolated. Please go to this picture. Do you see this brain tissue? This is what does separate the right and the left lateral ventricle. And I call this brain tissue cavum, septum, pellucidum. You do not have it written. Okay, I'll write it down for you. Cavum, septum,
How do you spell it?
cavum. Cavum means cave. Cavum, septum, pellucidum.
It's the board is too far. Your picture is too far.
Okay. Ah. There you
Thank you. Thank you.
Mm-hmm. Cavum, septum, pellucidum. And please write down next to it, brain tissue that separate the right and the left lateral ventricles.
Can you repeat that one more time? Sorry.
I charge $5 for repeating, Mrs. Ashley. Brain ventricle, brain tissue
That separates.
that separate the right and the left lateral ventricles. So one more time, your lateral ventricles on the right and on the left are not what? They are not connected. They're completely separate. Each one belongs to specific hemisphere, correct? What does separate them, Mrs. Jennifer?
The cavum, septum, pellucidum.
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 You can say only cavum septum, that's okay.
Okay.
Everybody will understand what you are talking about.
Okay.
All right.
Professor, can you go over what was the atrium again?
The yellow one.
Just that side, or are they on both sides?
I didn't get your question, sir.
Is the atrium on the right ventricle, left ventricle, or on both?
No. Each ventricle has atrium, frontal extension, occipital extension, and temporal extension. So look at my two hands. You get that?
Yeah.
So this is the right ventricle, and this is what? The left ventricle. Correct?
Yeah.
Okay. Mrs. Ali, what did I say earlier the ventricles contain? What's inside of your ventricle, of your brain? It's not a gold, neither diamond.
CSF.
I was writing stuff down.
Okay, let's see if
Oh
Mrs.
wait,
Leticia-
are you saying like it's? Oh no, that's what they do.
Mrs. Leticia will help you.
Okay.
Spinal fluid.
Cerebrospinal fluid. Correct? So we have fluid. Now, if you look over here, let me circle it for you. There you go. Do you see that circle?
Yeah.
The green circle. This is interventricular foramina, or you can call it foramen of Monroe. Please write down next to the foramen of Monroe. Foramina mean what? Do you guys know what's foramina?
Hole.
Hole. So opening that connect the lateral ventricle with the third ventricle.
Professor, that was interventricular foramen or foramen of Monroe?
Yeah.
Does it matter which term we use?
Does not matter.
I'm sorry, Dr. Paul, you said opening, connecting.
It's an opening that connect the lateral ventricle with that ventricle, the one I'm gonna put it in blue for you. And this one is what? Is your third ventricle.
Okay.
So if I ask you, Mr. Anthony, what does connect the lateral ventricle with the third ventricle? Your answer will be?
My answer would be
The foramen.
Foramen of Monroe.
Foramen of Monroe, correct.
Oh, you said opening that connects, sorry, I'm trying to write this all down.
An opening that connect lateral ventricle with the third ventricle.
Lateral ventricle.
If you go to the next picture, basically, you are seeing both sides, right and left respectively.
Mm-hmm.
And in this case, if you look over here, this and this, those are the right and the left interventricular foramina or foramen of Monroe. So the fluid from that ventricle will goes this way and goes to the third ventricle, and that fluid from that one will goes that way and goes to the third ventricle. So bottom line, this is your third ventricle. Okay? And let me be nice one time out of my life. This is the direction of the fluid. As you can tell, is it draining to where?
Into the foramen of Monroe.
From the lateral ventricle to the third ventricle. Correct? The next ventricle of your brain is the third ventricle. And your third ventricle identified at the level of the diencephalon. So this part of your brain, we call it what? Diencephalon. And the third ventricle, it is located in the diencephalon. Mr. Jonathan.
Yes, sir.
Do you remember what are the major part of your diencephalon from the previous lecture with Dr. Jacobus? I know I'm asking you long time questions, but just in case.
I'm gonna say no for now.
No for now. Okay, we'll talk about it later on. Is the thalamus, hypothalamus, and epithalamus. So your third ventricle, it is made by the wall of those three structures of the diencephalon, okay? And it is located, this is what most important, it is identified within the diencephalon. That's all what you need to know. Got it? All right, now, what's next? Your third ventricle move the cerebrospinal fluid through this canal. And let me point on that canal for you.
Aqueduct?
Exactly. There you go. Do you see that canal? We call it Sylvius or cerebral aqueduct. And then from the cerebral aqueduct, we are going to have another ventricle further, which is represent the fourth ventricle, which is this one. That's your fourth ventricle. Where is the fourth ventricle located anatomically? This is very important for you guys to identify.
In the palm. Okay?
Well, we said earlier this part.
Inferior, posterior.
This is anterior, and this is what?
Posterior.
Posterior.
It's
So
inferior, posterior.
anterior to the fourth ventricle is your pons, and posterior is your cerebellum. So this is where you suppose to look for your fourth ventricle on your image. Anterior to the pons, posterior to the, posterior to the pons, anterior to the cerebellum. So if I move to the next picture, basically, this is your aqueduct canal. And this is your fourth ventricle. Correct? What is the continuation of the fourth ventricle for the fluid? Well, the answer will be central spinal canal. The central spinal canal. When we cover the spine, we'll talk about it. But for now, just to understand it, this is the spinal cord. In the middle of your spinal cord, there is a hole, tiny hole. This is hole, we call it central spinal canal. Of course, meaning the fluid will circulate from your brain into where? Into your spine too. And we said this is a cushion. Protect your brain.
Is it just a cushion, or does it provide nutrients and remove waste as well?
It's a cushion, no nutrition.
No nutrition.
So let's go to this picture. This is an axial cut. And also, you need to remember that at certain level of the cut in axial, you'll be able to see specific ventricle. If we go back to this picture, let me go back. So you have to understand, if the cut at the level of the superior part of the cerebral hemisphere, you will see only what? The lateral ventricles. If the cut further down, you will see third ventricle and possibly part of the frontal and the occipital horn. If the cut further more down at the level of the temporal, you will see the temporal horn only. If you want to see the fourth ventricle, the cut has to be all the way down at the level of the brain stem. You guys need to understand that this, the brain stem, okay? So cut over here will show me something. A cut over here will show me something. A cut over here shows something. Over here something. Over here something, and so on. Okay? This is why each of those ventricles has landmark that you need to follow. So what's your landmark for lateral ventricle? You need to show what? The cerebral hemisphere. If I'm not showing you the cerebral hemisphere, you cannot see the lateral ventricle. What's the landmark for the third ventricle? You need to see the thalamus, the diencephalon. What's the landmark for fourth ventricle? I need to see the cerebellum and the pons. Otherwise, you do not see any of the above. So if you look at this picture, basically in this picture, you are not seeing anything other than part of the lateral ventricle. So what are this part of the lateral ventricle? I am seeing the frontal horns of the right and the left. As we said, they are separated by this tissue. Do you see that part? So this is part of the lateral ventricle on the right, and this is another part of the lateral ventricle. The extension toward the anterior are the lateral horn. So what does separate them, we said? Cavum, septum, pellucidum. Exactly. So if you go toward the posterior, you are seeing what? The posterior horn of the lateral ventricle. Now, the question is, why I am not seeing the atrium? Mm-hmm. Do you guys know why?
The cut is, never mind. I was going to say the cut is below.
Exactly. But also, how is your lateral ventricles, basically? Your lateral ventricles are not straight like this. If they are like this, then it's easy for you to be able to see the atrium with the occipital and frontal horn. But the reality, they are like this. If this is the atrium, that means the cut's supposed to be at this part. So this is the frontal and this is the occipital. I cannot have the atrium with those two. So either I see the atrium or I see what? Those two. So in this picture, particularly the one you have, the cut is where? This is what you are seeing. On the top of your image, you are seeing the frontal horn. On the bottom, you are seeing what? The occipital horn. Did you guys get the point?
Mm-hmm.
If you did not, say I did not. Correct? So for the
I had a question,
gentleman who
doctor.
was asking me, go ahead.
How do I put this?
What's
When we're
your
looking
name?
at James.
Okay, Mr. James, go ahead.
When we're looking at a cut, how much depth is there in a cut? Is it like a millimeter or?
What do you mean, how much the depth?
Well, so we're looking like at that image.
Well, when
Go ahead, Anthony, if you know how to say what I'm saying.
when we cut axial, what is your position to the patient? What's your position to the patient?
Mirror.
You are looking at the patient from the feet. Exactly. So when I cut everything below it, I'll take the rod and I throw it and you are looking through. Did you get the point, Mr. James?
Yes, but that wasn't what I was asking. I think, like in this image that we're looking at, how thick of a cut are we looking at? How much depth?
It's only a 2D image.
You mean the
yes
the
yes? Is
thickness
it like
of-
as thin as a piece of paper, or is it more like a millimeter so that you can see it in three?
Yeah, it's a few millimeter.
Few millimeters. Okay.
Yeah, well, this is something you will learn it in the procedure your next semester. They will
Okay.
tell you, and they will tell you how much you can choose the thickness if you wish.
Okay. I think that's what it was.
For the gentleman who
Or-
was asking earlier between MRI and and CT scan, if you look at this image, this is an MRI. If you look at the next image, this is a CT scan. Anatomically, both images are showing me same concept. The frontal horn, part of the lateral ventricle, the cavum septum pellucidum separation, and then the occipital horn. So anatomic wise, you will see everything is the same. So if you learn this picture, you do not need to learn that one because the concept is what? Similar, okay? Another CT scan, which is also, they showing you different, but in this cut, basically, if you look at the map, over here is your lateral ventricle. So the cut is all the way what? Below. This is anterior and this is posterior, meaning on the posterior aspect, which is based on the cut, if you look at it, you are seeing what? Right and left cerebral hemisphere. If I'm coming from anterior, before I see the cerebral hemisphere, I will see what? The pons. And if you guys remember, which brain ventricle located between the pons and the cerebellar hemisphere? We said earlier? Fourth ventricle. So if you look at this, that's your fourth ventricle. Did you guys get the point?
We don't see your screen anymore.
Oh, I'm sorry. Why are you not seeing my screen?
I saw it.
I just see the board behind you.
How about now?
Yes, thank you.
Well, you guys need to tell me if you're not seeing anything, okay? So one more time, for those of you that were unable to see, right and left cerebellar hemisphere, those are the most posterior. If you go toward the anterior, you are seeing part of your what? Of the brain, cerebrum. If you move toward the posterior, you are seeing the pons. And I said earlier, between the pons anterior and the cerebellar hemisphere posterior, you will see the fourth ventricle, which is, you guys see it here in green. Now, look at the cut map. They made the cut very what? Very inferior. That's mean what you are seeing in here, let me point on them with a different color, this and this. Those are the temporal horn of your lateral ventricle. So bottom line, that exactly this area and this area is the temporal lobe of your brain. I'm talking about those. Are you guys getting it?
Mm-hmm.
If you did not say I didn't. Nobody did. Good. If you move to the next image, which is, that's a midline sagittal. In the midline sagittal, basically, you will see all the ventricular system, but only for one side. You get the point? So if you start from the superior and going down to the inferior, what are you going to see first? Lateral ventricle. If you move down toward inferior, you will see the third ventricle. If you move further down, you are going to see the aqueduct of Sylvius. If you move further down from the aqueduct of Sylvius, you're going to see the fourth ventricle. And we said for each of those ventricles, you're supposed to use your landmark. For lateral ventricle, I will use the cerebral hemisphere. For the third ventricle, I will use my diencephalon. And the only part of the diencephalon that anatomically identified is the thalamus. The hypothalamus, it's not identified anatomically, guys. And then aqueduct of Sylvius supposed to be at the level of the brainstem, and then between cerebellum and the pons, are supposed to see what? The fourth ventricle. Everybody okay?
Yep.
Again, on this picture, they're showing you the pons and the fourth ventricle with the two cerebellar hemisphere. It's the same what we talked about earlier. This is a different, it's T-weighted 2 MRI, which is they showing you the ventricle in white. Also, you are seeing the frontal horn and the cavum septum pellucidum between them. And of course, you are seeing the third ventricle between the masses of thalamus. Same over here. Look at the map. Where is the cut? It's coronal, but not over here. They went all the way toward this side. So they cut this way. So that's why you are only see what? The occipital horn. The cut all the way toward the back. So you see an occipital horn. Also, because the cut all the way toward the back, that's mean you will be exposing part of your fourth ventricle, which is located on the posterior aspect. Any question so far?
Can we take a break soon?
Huh?
Can we take a break soon?
Who wants the break? Who's asking for a break? Your name? Are you
Michael.
tired? Okay, I want a break. I'll see you back in 10 minutes, guys.
I want to break. I should be back soon.
What?
Back to normal. Do you guys have any question so far?
Nope.
We're good? Okay. We've been talking about the ventricles of the brain, and we said the ventricles of the brain contain cerebrospinal fluid. Where's that fluid come from?
Choroid plexus.
Go ahead again.
Choroid plexus.
And where are choroid plexus located? If you look at this picture, do you see whatever in red?
Yeah.
Those are the choroid plexus. The choroid plexus are located within the ventricles of your brain, in every single one. So this is the lateral ventricle, this is the third ventricle, and this is what? The fourth ventricle. Inside of each of those ventricles, you have blood capillary network, small little tiny capillary blood. Every time your heart beat, there's a blood that reach those plexus. Part of the blood plexus, plasma fluid, will be filtered from the blood circulation and goes where? Into the ventricles. So bottom line, can I say that the cerebrospinal fluid resemble the plasma of your blood?
Yes.
The answer is yes. There is a small tiny differences between the plasma of the blood and the cerebrospinal fluid is the protein, the plasma protein. The protein in your plasma are more. The cerebrospinal fluid plasma protein are what? Less. Okay? So this is major differences. So one more time. The capillary or the choroidal plexus filter the fluid and allow it to go into the ventricle. The fluid will circulate from your lateral ventricle to the third ventricle, from the third ventricle to the aqueduct canal or aqueduct of Sylvius, from aqueduct canal into where?
The fourth.
Into the fourth ventricle. From the fourth ventricle, the fluid will have two pathways. First one will go further down into where?
The
central spinal canal.
Central. Wow.
Exactly. The other part of the fluid will exit from the fourth ventricle through two foramina. One located medial, we call it median foramina, and the other one located on the lateral, we call it lateral foramina. Also, some people, they use different name for those two foramina. One, we call it foramen of Magendie, and the other one, we call it foramen of Lussica. Where does the fluid go from those foraminas? Will start circulating around the brain and around the brainstem, also around the spinal cord. Earlier, I said which meningeal space contain cerebrospinal fluid? Mrs. Jennifer. Which meningeal space contains cerebrospinal fluid?
Subarachnoidal space.
Subarachnoidal space. So if you look at this picture, everything you see it in purple, every purple part represent the subarachnoid space containing cerebrospinal fluid. And this is something between, somewhere between the brain all the way down into your spinal cord. How does that fluid reach the subarachnoid space? We said will exit from the fourth ventricle through two foramina. The lateral foramina, we call it Lussica, and the median foramina, we call it Magendie. So if you look at this, that's the median foramina. And this is the lateral foramina. Did you guys get it?
Mm-hmm.
So one more time, the cerebrospinal fluid comes from where? Is generated by the choroid plexus, where I am going to circle it right now. Those are the choroid plexus. And the choroid plexus are located in every single ventricle. Our capillary network, tiny capillary, they filter the blood and they make the cerebrospinal fluid. That cerebrospinal fluid will circulate from the lateral ventricle to the third ventricle, to the aqueduct canal, to the fourth ventricle, and then will exit. Part of it will exit to go through the cerebrospinal subarachnoid space around the brain, around the brainstem, and around the spinal cord. The other part of the fluid will exit where? It goes through the central spinal canal. This is your central spinal canal, which is move the whole entire length of your spinal cord. It's a small tiny hole in the middle of your spinal cord. This fluid, it is non-stop regenerated. On every single beat of your heart, when the blood reaching the choroid plexus, a new fluid will be what? Generated. But what will happen to the old fluid? Well, the old fluid, it has to be taken out through the blood venous system. How? Let me go to the better picture than this one, which is that one. This is your subarachnoid space. Are you seeing an extension from the subarachnoid space? Which is, I'm gonna color it in green. Those are finger-like extension. We call it villus or villi. Where they are protrude, to which space? To the venous dura sinus, correct? Meaning the cerebrospinal fluid that circulating in a brain ventricle and exit to go in subarachnoid space will be filtered from the subarachnoid space into the venous dura sinus. Where does venous dura sinus end? Well, they're gonna drain the blood from your brain and from your neck and will take it back to your heart. The venous system always take the blood back to your heart, correct? So this is the way how the fluid will be regenerated non-stop. Did you understand?
Doctor,
Yes, sir.
I have a question. Have you ever done a CSF flow study before?
I can't hear you.
Have you ever performed a CSF flow study?
The tapping mean?
No, not a tap. Have you ever done a flow study of the CSF?
No.
Okay.
Do you
I was
have
just
any?
gonna ask.
What's the purpose of this?
They detect different disorders specifically in children, and I was just going to ask why on a T1 it comes up darker. I know it's delayed, but the CSF fluid is, you were talking about filtered out the proteins, but I was just curious why a protein would be bright versus a CSF fluid is created, the body has a purpose for it, and what would be the benefit? Because if it's just for cushion, right? Obviously, the plasma would still cushion, but I was just curious how far deep in it you understood the purpose of CSF fluid and the flow study. That's all. It's not important for right now.
What's your name, sir?
Anthony.
The CSF fluid, the major function is cushion. Also, it contains a lot of electrolytes, like sodium, potassium, which is, of course, electrolytes are essential for our basic activity included. But the proteins on the plasma cannot be filtered out as much as they are presented in the plasma protein, because protein molecules are large to be moving outside. And usually they have no function within the cerebrospinal fluid. That's why we don't see them as much as you could see them on the plasma. The cerebrospinal fluid major function is cushion and provide some electrolytes balance for your brain structure to function on, including the sodium and the potassium. Also, tapping the spinal fluid, sometimes we use it to determine possible problems, including those that they have meningitis, for example. If I need to do culture, exactly. If I need to do a culture to determine which bacteria,
bacterial, right.
Exactly. So we do a culture. We we take a little small amount of that cerebrospinal fluid and we put it in a culture to identify the bacteria, and based on the result, the doctor will be able to give a specific antibiotic that has more effect on those bacteria. If you guys remember, I told you previously, in my class, I do not get in depth, or basically I don't talk about function at all. Your class is not for function. I want to get strict only to anatomy, which is, this is the major concern for you guys in this class. If I have to start talking about function, then you guys will be overwhelmed. And it will take us longer time to finish every class. Probably I will have to stay until 4 o'clock. This is why I told you from last week, I will only discuss anatomy part. I don't discuss functional part. So if you guys wish to read more about function, you can use your previous book, or you can use any different other resource. But on my behalf, I will not ask you on the test any function related to what we cover. I presume that you guys already learned the functions. That's what was your previous semester. You have learned special anatomy structure with their function. Okay? Do you guys have any question related to the cerebrospinal fluid? No? If you move to next image, basically they are showing you the occipital horn of the lateral ventricle. And of course, where you see the brightness inside of that horns represent the choroid plexus. Again, you are seeing part of the lateral ventricle, and the choroid plexus are reflecting a little brighter in every one. Choroid plexus, when we get older, they become more calcified. All of our structure undergo something we refer to it by degenerative changes. Meaning, if you look at your structure when you are 80 and 70 years old, they will be completely different from 9 and 10 and teenager people. Reason, because our structure always in what? Change. We call it degenerative changes of the tissue. So this is why a brain MRI will show you a little more wider ventricles in old people, more calcification and more degeneration, including choroid plexus calcification, if you compare it to a teenager people. And of course, I am not talking only about the brain. I'm talking about every single other structure in your body will be different from teenager one. Any question? More question? Earlier we said the cerebrospinal fluid circulate outside of the brain ventricle and into the subarachnoid space. The subarachnoid space, somewhere between the brain and your spinal cord, it is a little bit wider. So let's pretend this is the subarachnoid space. In certain part between your brain and your spinal cord, it is a little bit what? Wide. When it is wide, we refer to that by cistern. So if I ask you, what is cistern? The answer will be a widened part of subarachnoid space. So this is the subarachnoid space. In this part, the subarachnoid space, it's a little bit what? Wider. So this is the cistern. Of course, cistern has function to protect more specific structure between brain and the spinal cord. And that's why you have more fluid within the cistern. So it's more cushion for specific structure. Also, the cistern are multiple. The two larger cistern in your body are cisterna magna, which is all the way on the posterior aspect of your brain between your cerebellum, and the occipital bone. The other larger cistern, it is all the way down on your spine, and we call it lumbar cistern. And of course, the lumbar cistern, it's used by the physician for spinal tapping. I was talking earlier about taking a little bit amount of the spinal cord and culture it to determine specific problem. So physician, they use the white part to what? To minimize the risk of the doctor puncturing the spinal cord during the procedure, okay? Some of those cisterns that you need to learn, they name them based on their location. So if you look at the first one, suprasellar. Word supra mean above, and silla, they are talking about the silla turcica. And if you guys remember last week, we said the silla turcica, it's a part of your sphenoid bone where the pituitary gland is located. So if you look at this picture, this is the suprasellar cistern. So whatever you see in this picture around the brain, basically is what? Is the subarachnoid space. But if you see, it's a widen, 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 widen part. Those widen part are basically the cistern, the one we are talking about it. And the first cistern is, we said, the one on the top of the silla turcica, or your pituitary gland. And we refer to it by suprasellar cistern. At that level over here, you have the optic chiasm, which is, we're going to talk about it next week. The area where the right and the left optic nerve, they will cross. And we refer to this by optic chiasm, which is also, there is another cistern known as chiasmic cistern, okay? So the major concern about this cistern is to protect more the crossing part of the right and the left optic nerve. And that's why they call it optic chiasm. If you move to the next one, we call it ambient cistern. This ambient cistern, basically, it's connecting two other cistern, interpeduncular and quadrigeminal. The interpeduncular and quadrigeminal. So look at this part. This is the ambient cistern. And it's connecting two different cisterns. The quadrigeminal and interpeduncular, those are two structures that we're gonna talk about them when we get next week to the brainstem, okay? It's just a matter that they are surrounded by a cistern, and there are the two cisterns of the quadrigeminal one and interpeduncular are connected by the ambient one. So the interpeduncular cistern, it is located between the midbrain peduncles, and it is communicated further toward the inferior by another cistern, which is, we refer to it by pre-pontine cistern. So your pre-pontine cistern is the cistern before the pons, which is, you don't see it in this picture, pretty much good, because it has to be a little bit below the cut, not in this one. And then the next one is quadrigeminal cistern, which is located on the posterior aspect of the midbrain, which is, has two large nuclei. We refer to them by colliculi. Also, we'll talk about them in detail next lecture, okay? Another cistern, which is pre-pontine cistern, which is located between, connect with the other cistern, which is cerebellopontine cistern. So you can tell that all the cisterns are connected, other than surrounding and protecting some structures, they are also what? Connect to each other. So all cisterns are connected to each other. As you can tell from this image, all those cisterns are connected to each other. So the cerebellopontine one, which is located on the lateral and anterior of the points and the cerebellum, and this cistern particularly protect some of the cranial nerve, 5, 7, and 8. If you go further toward all the way toward the posterior where I am circling, and I said this is one of the widest cistern, and we refer to it by magna. And the cisterna magna, it's obviously, this is your occipital bone, and this is your cerebellum. So it is always identified between the occipital bone and the cerebellum. Any question?
No.
No question.
Doctor, I have a question.
Uh-huh.
So would you say that the cisterna magna is in the same location where the cerebellum or the falxi cerebelli?
Well, the falx cerebelli, it's, you can pretend it over here. So I can draw it for you if you wish.
Oh,
there.
Okay, thanks.
Mm-hmm. If you want to see the cisterna magna in better way, let me show you in this picture. Probably you will understand it better. Do you see this part? That's your cisterna magna.
Okay. Thank you.
This is the cisterna magna, exactly. The cisterna magna is clinically, it is very important in infant and fetuses, because sometimes the cisterna magna, it's used to determine presence of any anomaly, whether that fetus is gonna born with the brain anomaly or not. And of course, when we identify it larger than normal, that's not a good sign at all, okay? Some diseases that cause the cisterna magna to be wide, basically, either the fetus is not gonna make it at the term, or if he does, is gonna end up with severe retardation. So I don't wanna get into the pathologies part, which is you guys, you don't need to worry about that one, okay? So if you look at this picture, basically they are pointing on several cistern. This is part of your midbrain. Let me circle it for you. So this is part of the midbrain. And as you can tell, there are several cistern around the midbrain. One of those cistern is the one you see it highlighted in white. So those are the colliculi, which is we're going to talk about them next week, as I said, of the midbrain. So between them, what you are seeing, the bright area, this is interpeduncular cistern, the interpeduncular cistern. So if you go more toward the anterior, you're supposed to be able to locate the pituitary gland and the sella turcica. So the cistern that surrounding the pituitary gland is the suprasellar cistern, meaning your optic nerve coming from this way, and part of it is gonna cross, and the other one coming this way and is going also to cross. So the crossing area between the right and the left represent the chiasma optique. So also the cistern over here, the chiasma cistern, it's to protect the interaction or the crossing part of the optic nerve. Make sense? If you move from the midbrain back to the pons, you are going to see the quadrigeminal cistern. So most of those cisterns are located at the level where the brainstem connect with your cerebellum. So this is the cerebellum, and the tip of my finger is the brainstem. So most of those cisterns are where? around this area. Or let's go and see it in the sagittal cut, which is, we don't have any picture for that one, but I can get a different one. If you go to this picture, which is a sagittal, basically most of your cistern are in this area. So this is your sphenoid sinus that we talked about it last week. That's your pituitary gland. So this is where the chiasma optic also located. This is the midbrain. That's the point. So most of the cistern that we are talking about are in this circle area. The reason why, because most of your cranial nerve, they start from your brain stem, from this area. And we need more protection for those brain stem, for those cranial, okay? A CT scan for some other cistern, which is basically we saw on that same picture, previous one, but just they showing you in the CT scan. So also you same, you have the midbrain and you have the right and the left peduncles, and between them you are seeing the peduncular or interpeduncular cistern. If you move toward the lateral, you will see the ambient cistern. So this is the ambient cistern. If you move toward the anterior, this is your part of your pituitary gland, and this will be the suprasellar cistern. If you move toward the back, you will see, as I said, the ambient cistern. If you look at this cut, where it's all the way down, and earlier in sagittal, I said most of the cistern are around this area. So this is the right and the left cerebellar hemisphere. You see? Meaning, if I go toward the anterior, I will see the brainstem part, which is more specifically, if I want to be, is the pons. That's a part of your brainstem. So that's your brain, that's the brainstem, and behind it over here is the cerebellum. So basically I'm seeing this area, the pons and the cerebellum, exactly. So if you see where you have, this is a cranial nerve that comes out of your pons. And of course, we said those, they need to be protected. So the part of the cistern that it is anterior to the pons, we call it pre-pontine cistern. So this is a pre-pontine cistern. Also the pre-pontine cistern, you can tell that protecting one artery that supply your posterior aspect of your brain, the basilar artery. We'll talk about it next. A continuation of that pre-pontine cistern toward the right and the left respectively will be cerebellopontine cistern. That's the cerebellopontine cistern on each side. And of course, your acoustic nerve number 8, you can tell that it is protected by those cistern. If I move more toward the posterior of the pons, between the cerebellum and the pons, I said I will see what? The fourth ventricle. So this is the fourth ventricle of the brain. If you move all the way toward the posterior, meaning this is the occipital bone, supposedly, even if they don't have it in your picture. But earlier I said between the occipital bone and the cerebellum, I have a big wide cistern. Even if they didn't point on it over here, I can use the anatomy word to describe it. That will be your cisterna magna. So whatever I highlight in red, that it is the cisterna magna. Any question? You are saying same concept of the image below. This is the cisterna magna because that's your what? The occipital bone. Meaning this is the right and the left cerebellar hemisphere. That will be my pons. And between the pons and the cerebellar hemisphere is my fourth ventricle. Exactly. So if this is my pons, that's mean over here, I'm supposed to see what? The pre-pointine, and then further toward the side over here and over here is the
middle.
Which one? If we go to the previous picture, cerebropointine. So you are just seeing in different aspect. It's the anatomy is the same. This is MR, this is CT scan. So this is the pre-pointine cistern, and this is the cerebropointine cistern on the side. Make sense?
Yeah.
Any question?
No.
No question. So, if you guys remember, when you learn with Dr. Jacobus about brain structure, your brain structure consists from superior going down toward inferior, right and left cerebral hemisphere, separated and connected by corpus callosum. If you go further down, the diencephalon. If you go further down from the diencephalon is the brain stem. And then toward the posterior most aspect is your cerebellum. A continuation of the brain stem will be the spinal cord.
Brain.
Correct?
Yeah.
So let's talk a little bit about cerebral hemisphere. As I said earlier, I will not talk about any function, and if you wish, you can read from your previous book. I will keep only for the anatomy, okay? If you look at your brain hemispheres, basically are right and left separated by or connected by corpus callosum. So basically you are seeing a crack between both of them. And this crack, we call it the superior sagittal fissure. Superior sagittal fissure. And of course, the dura, we say fold within it. And I fold of the dura, I will call it what? The falx cerebri. So in this picture, basically, if you are looking, you can see the superior sagittal fissure, which is represent that crack. And within that crack, I said the dura matter will fold to create the falx cerebri. Also, you can notice even with the MRI, you can differentiate two colors of the cerebral hemisphere, the white matter and the gray matter. The gray matter, it is always located in the cortex, meaning it is toward the surface outside. The white matter is in the medulla, toward inside. Do you guys remember why we see them white and gray for?
Has to do with the sheath, I think. Of the axon.
The sheath. That's mean. What do we call that sheath?
Myelin sheath.
Exactly. The myelinate, whether they are myelinated or not myelinated. Okay. And do you guys remember what's the reason for myelination?
So that your electrical activity doesn't stray off?
The myelination is to speed up the stimulus.
Yeah.
Make the stimulus reach faster. Okay. So the right and left cerebral hemisphere are completely isolated and they are connected only by this structure, which is, we call it corpus callosum. So that's your corpus callosum. So the stimulus between the right and the left will be only connected through the fibers, axons that move through the corpus callosum only. And your corpus callosum consists of the first part and the most anterior. This is the anterior, that's posterior. The most anterior is the genu. I'm sorry, the first one is the rostrum. So this is the rostrum. And then the genu, the corpus, and the splenum. Make sure to remember them, okay?
Yeah.
The corpus callosum, you can tell run from anterior to posterior, this direction. So if I cut sagittal, I will see all of it. But if I cut coronal, I will see only what? Part of it. So if you look at this picture, this is what? That's a coronal. That's a coronal cut this way. So you are seeing only that part of it. You do not see it. And of course, they are showing you over here the what? The fibers that connect the right and the left cerebral hemisphere through the corpus callosum. The surface of your brain, it's not a flat. Basically, it's what? Wavy, up and down. Correct? So the curved up part, we call it gyri. And the crack between them, we refer to them by sulci. So what you guys are seeing, those lines are the sulci. But what you are seeing, this is the gyri. Those are gyri. So between them is the sulci, and those are the gyris. So it is not flat. Even if some kids, they're born with the flat, little bit flat, we refer to it by Linsencephaly. Linsencephaly. And of course, they will have severe retardation for that part. So this is something part of normal our brain structure, the gyri and the sulci. Okay. Now, at some point, some of those gyri and sulci are a little bit deeper than normal, like you can tell. This one, this one. They don't want to call them gyri and sulci. They give them name like fissures, which is they do separate your cerebellar hemisphere into what? Into lobes. Based on this, the name of the lobe are given by the name of the bones. That's the frontal lobe. This is the temporal lobe. That's the parietal lobe, and this is the occipital lobe. Now, of course, each of your brain lobes, they contain specific function, and some function, you have it on the right side, you do not have it on the left side of your brain. If I flip out the temporal lobe, I will see whatever you guys see in green over here, which is a small tiny lobe. We refer to it by the insula. The insula one, okay? Each of those lobes, as I said, they have function. And you guys have learned about those functions with Dr. Jacobus. So some functions that are related to the parietal lobe, which is the sensory area. And the sensory area, it's to detect the sense. The frontal lobe has what? The motor, which is the movement. The temporal lobe have what? The speaking area, correct? The hearing.
Broca.
The Broca, exactly. Broca area, which is the speaking. And the occipital lobe has the vision area. As I said, I am not going to ask you about function, okay? If you guys wish to read it for your own, you could do so, but I will not ask you, okay? I said earlier that when we look at the brain, we are able to identify two different colors. So if you look at this picture, the gray are located in the outer part, which is, we refer to it by the cortex. In return, the inside part is the medulla, and this is a white. But also within the medulla, I am seeing gray matter islands. Like what you are seeing, it's over here. Those we call them gray matter embedded inside the white matter. And those we refer to them by the basal nuclei of the brain. Basal nuclei of the brain. Do you guys know what is nuclei? What's nuclei? Anybody know what is a nuclei? This word. How about, do you guys know what is ganglia? What is ganglia?
Aren't they like folds in the like kind of like a worm that kind of?
Okay, if you guys remember the cell.
It's like the nucleus, the seed.
I'm sorry, go ahead.
The nuclei is like a seed.
I'm unable to hear.
Is it considered the center of the cell?
Okay, don't worry about it. I'll explain it for you. That's okay. You guys remember the cell of the neuron consists of the body and the extension. So this is the body of the neuron cells. The small extension, we call it dendrites, correct? And the longer extension, I call it axon. Now, in certain part of your body, you have cluster of neuron body cells. That's mean I'm taking the axon out. You see, a cluster of neuron cells body, if they are located in the central nervous system, meaning in your brain and your spinal cord, then I'm gonna call them what? Nuclei. So if I ask you what is nuclei, your answer will be neuron cells, body, collection, located within the central nervous system, brain and spinal cord. If I have the same collection of the neurons, cells, body, but they are located outside of your central nervous system, that's mean not inside the brain or the spinal cord, then I'm gonna call them ganglia.
White matter.
Did you guys understand it?
Mm-hmm.
So what I circle for you in this picture basically are nuclei. Those nuclei are bunch of neuron cells body located inside the brain, and they refer to them by basal nuclei. Of course, they have several functions. One of the most important function is to coordinate your movement. If you wish, you can go back to your previous book and read about the function. But those nuclei consist of, number one, the top is caudate nuclei. And then if you go further down, you are going to see from outside toward inside, if you wish to remember them like this, or you can remember them vice versa. The most outer one, we call them the claustrum. Further toward inside, putamen. Further, globus pallidus. Both putamen and globus pallidus, they refer to them by lentiform nuclei. The lentiform nuclei. Are you guys getting it, or you want me to repeat it?
Getting it.
Okay. If you look between the claustrum and the putamen, there is a white fiber of the axons, and those represent the external capsula. The external capsula. between the caudate and the lentiform nuclei, you will see another white fiber, which is represent the internal capsula. So the internal capsula, or if you wish this way, like, let me point on them with the color better for you guys. So this is the green where I'm pointing, this is the fiber of the internal capsula. In return, this is the fiber of the external capsula. And of course, the fiber of the internal and external capsula, they carry measure of the stimulus for the motor function of the body. Those are connected to what you guys learned, probably pyramidal tract. But anyway, our major part that what you guys need to learn is those nuclei, and you need to remember them in sequences, because this is the way you're gonna point on them easily on your image, okay? So if you look at this cut, this is a sagittal, but it is not 100% midline. This is, we call it what? Parasagittal. Exactly, so that's a parasagittal toward the right. And of course, they are showing you part of the cerebral hemisphere, and they are pointing on Broca area, which is located in temporal lobe, frontal lobe, and then they are showing you part of the pre-central gyri, which is separate the parietal from the frontal also. So this area, we call it post-central. This is the pre-central. The post-central area, it's always sensory in function. The pro, it is motor in function. You go further more toward the back, you are seeing part of the occipital lobe, and all the way further toward inferior part of your temporal lobe. So for this picture, you do not need to worry about anything other than pointing on frontal lobe, parietal lobe, occipital lobe, temporal lobe, okay? Nothing else. If you move to the coronal cut, basically, you are seeing this part of the corpus callosum that move and connect the right and the left hemisphere. So this is the corpus callosum fiber connecting the right and the left cerebellar hemisphere. As we said, they are separated completely except for this area. Make sense? And of course, based on the cut, I have over here the temporal lobe, the right and the left one. If you go up, you have the parietal lobe. A mid-sagittal cut, you'll be able to see the whole entire corpus callosum. And we said, your corpus callosum consists of 4 regions, starting from the first one that we call it the rostrum, and then the genu. The genu means always curve. And then you have the body. And then the last one, which is toward the most posterior aspect, is the splenum. If you move toward the superior from the corpus callosum, basically you will see the cerebellar hemisphere. If you move more inferior, then you're gonna see your diencephalon. So this is one single hemisphere that will be the frontal lobe, the parietal lobe, the occipital lobe. And of course, you do not see the temporal because it is gone with the cut. In axial transverse cut, also, you cannot see the corpus callosum completely. You will see only what? Part of it. You cannot see. Why? Because your corpus callosum is what? Curved. That's the way it's the corpus callosum. So an axial cut will show me only specific part. Make sense? You cannot see all of it. You won't be able to see all of it. So based on this, if you look at this picture, what are you seeing? you are seeing only part of the corpus callosum. Based on the cut, it is what? That part, the genu. Exactly.
Yeah.
So this is anterior and this is the posterior. So if you look on my picture, this is the anterior and this is the posterior. And the cut, it's completely where? Yeah. So I am seeing on the posterior that portion. From the anterior, I'm seeing that portion. So this is why the anterior, I'm seeing that portion, and for the posterior, I'm seeing what? That portion. So I'm seeing the genu part and the spheno part, but not the body or the rostrum. Did you guys get the concept? Okay. Of course, for the cerebellum, you could tell this is the frontal lobe, parietal lobe, occipital lobe. Also in coronal cut, which is me, that way. It depends where I am cutting. I'm cutting over here, or I'm cutting over here, or over here. So it depends at the level of the cut. You'll be able to see the part. So if you look at the map, they said the cut is almost on the middle at the body level. So these fibers that crossing between the right and the left hemisphere is what? Is the corpus of the body of the corpus callosum. That's mean I have to see part of your temporal lobe toward inferior. So this is inferior, this is superior. So you will see the parietal lobe. And make sense? Sometimes. There is a fibers that move from the right to the left cerebral hemisphere through the corpus callosum. But also there are fibers of the axons that move at the same hemisphere, anterior to posterior or posterior to anterior. So there are always connection between every single hemispheres. Also, there's a connection between the hemispheres. The connection within any hemispheres, we refer to it by commissures. Okay? It's something that you don't need to worry about too much, okay? But just because they have that picture. So they are showing you the connection through the anterior commissures in this picture. Over here, they are showing you the connection through the posterior commissures. As I said, there is a connection in this direction and in this, and we refer to it by intercommissural fibers, which is they connect the same side of each hemisphere together. So again, same concept like the previous picture where they're showing you the posterior commissure connection for the right and for the left hemisphere. This is a coronal cut where you'll be able to see the right and the left parietal lobe. And if you go toward inferior, the right and the left temporal lobe. And of course, this is what you guys learned last week, the sphenoid sinus. That's mean this is part of your pituitary gland. That's the lateral ventricles. And of course, this is the sagittal fissure, or if you want to call it falx, that works too. The falx, or you can call it superior sagittal fissure, and you are seeing the right and the left side of the frontal lobe. And of course, toward the posterior, you are seeing part of the cerebellum. What you guys see in yellow, will you be able to tell me what structure is that?
Pons?
Pons?
That's the pons. I take it. And what I'm gonna point right now in red, what is this? What's located between the pons and cerebellum?
The fourth ventricle?
That's the fourth ventricle. Correct. How about what I'm gonna color in blue?
The magnum,
The cisterna magna.
Yes.
Correct. The cisterna magna. So, which bone is that bone will be?
Occipital.
Do you guys know the name of your friend that having a nap? Do you guys see each other or no?
Not
Oh, we see him.
You guys only see me. You don't see each other, right?
I see. It's Eric.
I see him.
I see it.
What's his name?
Eric.
Eric?
Eric, what's up?
Mr. Eric,
Okay.
how many shots of tequila did you have last night? Huh?
None.
And how many shots of tequila did you have, Eric, last night?
None.
What do you mean none? You're
I-
sleeping. You know what's sad part? The sad part that you didn't call any of us to share.
Correct.
Next time you need to share, okay? All right, Mr. Eric. I'm gonna ask you one question. If you answer it, you go back to sleep. If you don't, you have to stay awake.
Damn.
Come on, Eric.
What is this?
Can I answer it, please?
Okay, let me make it simpler on you. Which ventricle I circled?
The fourth ventricle.
Then you need to stay awake. Anthony, do you know?
You circled the third ventricle.
That's the third ventricle.
Yes.
Again, in this image, which is parasagittal toward the right, they are trying to expose part of the nuclei, because the basal nuclei of the brain are located right and left respectively. So a cut midline, I cannot see any of them. So the cut has to be what? In sagittal. If it's in sagittal, it has to be either left or right parasagittal. So what they're showing you, part of the caudate nuclei, which is this one, and then part of the lentiform nuclei, and then toward more posterior, you're supposed to have the claustrum, which is they didn't point on it, but also you are seeing the internal capsula fiber moving between them, as we said previously. In axial cut, you'll be able to tell about those nuclei easily. And just for now, we're gonna talk about it in a little bit to understand them. I am going to point on your third ventricle, which is, this is the third ventricle. Always, your landmark for the third ventricle, we said, is the diencephalon. And your diencephalon, the only part of the diencephalon that can be imaged is the thalamus, because the thalamus is the largest part of your diencephalon. So this is the two masses of the thalamus, the right and the left one. Meaning, if you want to point on the caudate nuclei, on the basal nuclei, you will need to use the thalamus. That's the best one. So if you start from the most anterior, you will see the caudate nuclei. If you go further, the very first one that close to the thalamus is the globus pallidus. If you move toward the outside, you will see the lentiform as a part of the globus pallidus or putamen. And then toward the most outside, you are going to see the claustrum. So one more time, to easy way, use thalamus to point on all those nuclei. It is easier for you. That's the same picture, the previous one in CT scan, but the structure are not as clear as the previous one. But over here in CT scan, I am seeing better the third ventricle. So you need to relate the third ventricle always to what? To the thalamus. So if you said this is the third ventricle, that means this is my right and left masses of the thalami. Okay? How do I point on the caudate nuclei? It has to be where? Toward the posterior of my lateral ventricle frontal horn. So this is a caudate nuclei. And of course, move from thalamus toward this direction to point on putamen, lentiform, and claustrum, or the globus pallidus for the basal nuclei in sequences. Over here, it's pretty much internal capsular fiber is showing than the other image better, which is we said will move between the basal nuclei. So if I go toward the side, right and left respectively, I will see the fiber of external capsula. So those are the fiber of the external capsula. So between the fiber of the capsula, internal and external, you are able to identify the what? The lentiform nuclei, which is, I put it for you in yellow. If those are the lateral ventricles with the third, then I am going to have the caudate. So this will be the caudate, and that will be another caudate. Always, guys, you need to use the anatomy word to conduct yourself of what you are seeing. Do not try just to memorize, because after the exam, you're going to forget it. You need to keep them until we finish the whole semester. And maybe you need to keep them for your own career, right? So try to learn it the proper way. Take a 10-minute break. We'll be back. We'll go back to sleep, Eric.
Look how